Welcome to Spine Academy. In this video, we're going to discuss the natural history of cervical spondylosis. This is an excerpt from a broader course on the non-surgical management of cervical spondylosis. If you're interested in viewing the full course, we've left a link in the description. So the first thing that we're going to talk about is natural history of cervical spondylosis. Before we go too far, I'd like to define what we mean when we say natural history in a clinical context. What it typically refers to is the usual natural course of disease progression if you didn't render any type of treatment. So it can be used in reference to heart disease or cancer or certainly cervical spondylosis. When we think about natural history, then what we're really saying is how would the symptoms evolve over time if you didn't do anything? And that's important to understand before we talk about the specific types of treatment. So now if we break down those symptoms as we have discussed before and talk about cervical myelopathy, cervical radiculopathy, and neck pain, those different symptoms evolve differently and the natural history of them is different. So we'll start out by talking about cervical myelopathy. Once again, cervical myelopathy is the problem of spinal cord dysfunction. It's difficulty with clumsiness or balance dysfunction. It can affect the arms, the legs, or all four of those. As symptoms of myelopathy evolve, they tend to steadily decline. Myelopathy is not one of those things that generally gets better on its own. So the natural history is one of steady decline. What that decline looks like depends on a few different factors. Generally, the distribution can expand. So if it starts out in just the arms, eventually it can involve the arms more severely, but even involve the legs. It doesn't always involve all of them, but the distribution can expand to include everything below the level of compression. Usually when people start out, they'll have symptoms in the hands, but then unsteadiness in the balance. And I tell people to look for those symptoms as it evolves, as that will be an indication of progression. The other thing to mention about it is that the severity of those symptoms can worsen over time. It tends to be a slowly progressive condition. It does not, as I said before, get better on its own. Generally, it progresses over months to years. It's not typically something that gets worse by the day or worse by the week. I have certainly seen patients where they get worse over the span of weeks, but the typical course of it is measured in months to years, that people will decline over months to years. It's also not the case that people get worse day to day. People tend to get worse in a monotonic fashion, which means that they steadily decline, but often in a punctuated fashion. And what that means is they might be kind of at this neurological level and then take a little bit of a step decline, and then kind of continue, and then a little bit of a step decline. So we call that a stepwise decline, and that's typically the course of cervical myelopathy. So if we had to summarize the natural history of it, it is something that typically does not get better on its own. It typically steadily declines, usually over months to years. And the most common pattern that we see is one goes from maybe affecting one or two limbs to affecting all four, and it tends to monotonically decline in a stepwise fashion. The second pattern to talk about is cervical radiculopathy. Cervical radiculopathy is a condition of nerve dysfunction, so it usually involves one or more of the nerves in the cervical spine. Generally, when people have symptoms of cervical radiculopathy, the symptoms are limited to wherever that nerve goes. Usually the types of symptoms people get when it first starts will be problems with shooting pain, sometimes weakness, numbness, and tingling. Again, it's usually limited to a specific nerve. It doesn't usually spread from, say, C6 into the C7 distribution or something like that. It may not involve the entire distribution, and in fact, when it starts, it's often the most severe. It comes on with a bang, and then slowly subsides over time. So maybe it goes from involving the entire C6 distribution to involving a little bit less and a little bit less over time. So it will often, as it evolves, get better, typically shrinks in distribution. The first symptoms to get better is usually pain. That's usually the first thing that will improve. Weakness takes longer to get better if you have it or if patients have it. And then numbness and tingling really takes the longest. And that is a phenomenon related to the type of nerve fibers that create those different symptoms. So again, pain tends to get better first, weakness takes longer, numbness and tingling really take the longest to get better. Sometimes as people's symptoms evolve, they'll develop some neuropathic symptoms, we call it like burning or hypersensitivity or something like that. That really is a byproduct of chronic nerve injury. But generally, people's symptoms will come on really severely and diminish over time. The typical course is for the symptom intensity to shrink, the distribution to diminish, and also the episodes to kind of evolve from, as I said, pain to weakness, numbness, and tingling as all of the different symptom characteristics get better. Most episodes will resolve within 6 to 12 weeks. We still try different courses of non-surgical treatment that we'll talk about in this specific chapter. But if they don't get better within 6 to 12 weeks and are refractory or haven't gotten better in response to conservative treatment, that's really when we talk about surgical intervention. But the natural history of cervical radiculopathy is generally to get better over 6 to 12 weeks and with conservative management. So the last pattern that we're going to talk about is neck pain. Neck pain is quite variable. There are a lot of different causes, as you can imagine, to neck pain, so predicting how it will unfold over time is difficult. We certainly can't paint with a narrow brush in terms of that. Neck pain can be muscular, it can be radicular, which means it kind of is caused by a nerve, especially the upper cervical nerves. And figuring out where it's coming from can influence not only management options, but also help us predict how it would evolve over time. It's difficult. Some people will have a short course of neck pain that lasts a few days, and some people will have chronic neck pain. And so to that extent, painting a reliable picture for the natural history of it is very difficult. The typical course of it over time is quite variable, but often responds to conservative maneuvers. And we will talk specifically about the types of conservative treatment that we use when people have neck pain. Thank you for watching this video. I hope you found it informative. If you've enjoyed it, please like and subscribe. If you have any questions, comments, or ideas for future content, we'd welcome them in the comment section below.